Hello everyone, this is Dr. Karthik Valipe, consultant psychiatrist at Asha Neuromodulation clinics. In this video, I want to answer another of our frequently asked questions: is TMS the same as shock treatment? So to answer that question in brief, firstly, no, TMS is not the same as shock treatment. We'll elaborate further on why that is the case. To take you through an introduction of shock treatment, which is technically known as electroconvulsive therapy or ECT. ECT is a form of neuromodulation treatment which involves passing of current through the brain and inducing a fit or a seizure in the brain. Hence, it is called as electroconvulsive, which means inducing a fit therapy, ECT. ECT is a proven treatment for depression and several other mental health conditions, and it has been around since the 1940s. And TMS is a relatively newer modality of neuromodulation, and it has been in clinical use since 2008. Now, I will take you through some of the differences between ECT and TMS. ECT uses electricity as the mode of brain stimulation, while in TMS, magnetic pulses are sent into specific brain regions. So ECT is a generalized stimulation, while magnetic treatments, that is TMS specifically, transcranial magnetic stimulation, involves focal stimulation of certain brain regions. ECT involves inducing a fit in the brain, inducing a fit or a seizure in the brain, while TMS does not involve the same. Another key difference is the use of anesthesia. With ECT, we have now what is called as the modified ECT or MECT, which uses anesthesia in every case of ECT. Due to the use of anesthesia, there are certain caveats associated with the ECT. One being, it is better done in an inpatient kind of setting rather than an outpatient setting, although it can be done in an outpatient setting. It involves the assessment by an anesthetist and a general physician to check for medical fitness for ECT, and there is some pre-procedure preparation involved, which is something like staying on an empty stomach for around a duration of 8 to 12 hours. And there is also some post-procedure recovery time required due to the use of anesthesia, during which one will have to stay on an empty stomach for a period of maybe 2 to 3 hours or more. These are some caveats associated with the administration of ECT. With TMS, there is no use of anesthesia, hence there is no assessment required by a general physician or an anesthetist. There is no pre-procedure preparation or post-procedure recovery time required. And also related to the side effects, with ECT there are some specific known side effects like headache, muscle soreness, and sometimes memory related disturbances. These memory related disturbances, it is important to note, are relatively short lasting and recover in a vast majority of the patients over a period of a few days to weeks. Coming to TMS, the most common side effects are headache and fatigue. The memory related disturbances are not seen with TMS. To conclude, both ECT and RTMS are very safe and very effective treatments for depression. The choice of treatment is best made after a detailed discussion with your treating psychiatrist about the risks and benefit of each treatment. If you have any other follow-up questions, please feel free to post them in the comments or reach out to us. If you feel like you're suffering from symptoms of depression, please reach out to us or come down to our clinics to have a detailed assessment and a management plan with one of our psychiatrists. Thank you.